I think one difficult thing about being trans is that a lot of the trans people I know are around my age. So it's hard to find role models who are 10, 20 years older than me who are modeling what it's like to be out as trans as a physician or a scientist, experiencing things like that.
Hello, everyone. I am Dr. Moss from Life as a Patient Doctor. I am very excited to interview Carson Hartledge, who is an MD PhD student at the University of Cincinnati College of Medicine, currently in their first year of PhD graduate school after finishing their preclinicals. Their research focuses on the integration of healthcare system data and community-level data to identify and respond to health disparities in pediatric populations. They also serve on the boards of trans rights organizations in their state. Carson is heavily involved in health advocacy at the institutional, local, state, and national levels, with focus on LGBTQ+ and trans health, reproductive justice, and access to affordable healthcare. They aim to utilize their scientific and medical expertise and advocacy experiences to promote health equity and drive policy change. Thank you so much for being here, Carson.
Thanks for having me.
I want to learn more about you and your background in journeying to medicine to date.
Yeah, as you mentioned in my bio, I'm an MD PhD student, and I was set on doing a PhD through most of college. So was more interested in the research side first. Didn't become interested in pursuing medicine until later. And I think something that's really guided my interest in medicine is coming out as transgender and seeing how that significantly affected how I interact with the healthcare system. And also noticing just a huge lack of trans physicians in the field and wanting to be able to use like my educational privilege to improve representation in the field and care for people in my community.
That's beautiful. I love that. I love hearing how individual life experiences propel you to do something about it. At what point did you switch to medicine? Was it really recently, like at the last of college?
It was definitely towards the end of undergrad. I ended up taking a couple of years between college and med school, which I think was super important for my self growth and just learning how to be an adult.
Okay, so you got into med school. You've already had first couple of years. How did that go? What were the different ups and downs of your journey so far?
I would say, especially after taking gap years, getting back into the rhythm of preclinical was really hard. It's a constant cycle of exams and the sheer amount of information you have to learn in the first half of med school. I just put my head down and said, I have to get through this, even if it wasn't my favorite part of my medical education. I'm happy that it's behind me. I think I learned a lot, especially just about taking things in stride and that I'm not always going to get the best grades, which I think a lot of people in med school did get the best grades in high school and college and have to change their frame of mind once they get to med school. I think just learning how to have an identity and self-worth outside of academics has been really important to me.
I completely agree with you. It's definitely a jolt to be super smart in high school, and then suddenly everyone around you is super smart, and you can't all be 1% anything. What you said, how your identity is outside of medicine. How did that support you in your preclinical year?
I think a huge factor in why I chose to go to Cincinnati over other med schools was that there are other trans students at our institution, as well as some really awesome faculty champions to support us. And I think that's made all the difference in just my general level of happiness and support. Through the first 2 years, the majority of trans med students are the only trans person in their entire school. I think it'd just be really hard to be a trailblazer in everything, as well as having to deal with the stresses of typical med school.
That is such a good point. It's hard. I recognize that of any type of marginalized identity of being like you have to be the first or everyone's looking at you as the representation of everything else. I'm interested because you said you specifically chose that school because of trans individuals. Was there something you specifically asked for when you were going through med school interviews, or how did you find that out?
I did ask, and there are multiple trans students in the MD PhD program, which is also, I would say, pretty unusual because it's a lot smaller than the med school. I was able to talk to those students and see what the environment was like for queer and trans med students. And that gave me the confidence that this was the right decision.
That's awesome. I'm so glad that there's more representation in especially the research community. How has having a trans identity impacted how you view medicine or how you're going to help other patients?
I think it's just made me a lot more conscious of barriers that people face, even accessing basic care and how that extends to other identities that I don't hold. And I think motivates me a lot to tackle the structural issues that prevent people from getting the care that they need, as well as just general cultural sensitivity among healthcare professionals, I think is something that has improved, but still has a long way to go.
I don't know a lot about the area of Cincinnati. How is the culture? I know that in my school, we are very LGBTQ and trans family. So from the very beginning, we were learning about the history and using pronouns and how to introduce ourselves to patients. How do you want us to address you? How has your school or the area worked with that?
Yeah, I would say we're pretty good. We have a few faculty members who are huge champions for trans patients and have pioneered a trans health curriculum just in general. So I'd say we definitely have more than a lot of other schools, just because of how rigid preclinical curriculum is. It can be hard to integrate that into everything. Sometimes it can be framed as we just learn about it in psych as a part of the DSM, or queer patients only come up when we're talking about sexually transmitted illnesses. I'm not super involved in med ed advocacy, but other people at my school are, and working really hard to make a difference in those areas.
That's such a good point. I feel like it is sometimes segregated to a specific organ system, and it's should be definitely incorporated with every single other one, or maybe have its own. I've never really thought of it that way, but that is such a good point. I did a fourth year gender affirming elective, and that gender affirming elective was under the psychiatry clerkship. Thinking about it, I spent more time with the surgeons, not in psych. We did have one psych clinic, but beyond that, maybe it should have been for endocrine or family medicine. It's all of medicine. People receive care from all different specialties.
We have an elective like that, I think, is pretty interdisciplinary as well.
Mm.
I think just the point that trans people are going to need to see GI or radiology, and nailing down the point that just because you're not in family medicine or psych, you still need to be aware of different populations of patients.
Have you had the opportunity yet to work with other trans patients or LGBTQ patients? I know it's pre-cool, but do you get any opportunity to work with patients?
Yeah, we had a primary care class threaded through our first 2 years where I spent half a day in clinic every other week in a family medicine clinic at UC. And the preceptor I was with, the majority of her patients are trans. That was super cool. And I think it was very refreshing every 2 weeks to realize why I wanted to come to med school, even when I was bogged down with exams and other things, and be reminded of why I came here in the first place.
I'm so glad you had that opportunity. I think it's so important to have that in preclinicals when you're focused on books or tests or questions. I'm interested if when you were in that clinic, was there a process of you just yourself, or how did that dynamic go as a sharing identity, if you're comfortable with talking about that?
Yeah, I think just basic introduction with pronouns is what I would usually do. And I had pronoun pins on my white coat. And I think I'm also fairly visibly queer. Even if patients didn't explicitly say something, there was usually just a look of recognition. I know if I was in clinic as a patient and I had a trans provider, I would be so excited and I'm probably too scared to say something. But it was still really nice and really rewarding, just the level of implied understanding between me and the patients.
Yes, can you talk more about that? Because I think I love hearing that. The shared understanding, like there's something so unique about that.
Yeah, I think using the same language, and obviously I don't share everything with every other trans person, but the level of trust was probably higher that I wasn't going to ask invasive questions or use language that they didn't like. Something I also noticed is how grateful people were to my preceptor. She's amazing, but it makes me a little sad that people are so happy just to get good basic health care and that you have to be so lucky to access a provider like that. because she basically doesn't take new patients very often, only a few a year. So I think that it's hard for people in the community who don't have access to providers like that.
Yes, you make such a good point. It feels different when you can share language or culture. I definitely resonate with that. What are your thoughts on having more diverse perspectives in the medical community?
I think I said before, it makes all the difference for patient care. Also thinking about people in my med school class who share different identities from I do, I think enrich the experience for everyone. And I know Cincinnati is definitely not perfect. I'm sure a lot of other medical schools have their issues as well. I know a lot of people advocate for reform and admissions process to increase that. I know we are really good at recruiting queer and trans students, but maybe not as good at recruiting Black students and students of other backgrounds. So I think appreciating what we have here while also advocating for change in the future, because I think that just makes everyone around you better when you have providers who share backgrounds with patients and providers who come from different backgrounds than you.
That is definitely very important. So we talked about you going the MD route. Tell me about this PhD. You said you were interested in research. I mentioned a little bit in your bio, but tell me more about the PhD research route for you.
So it's still pretty fresh. I started less than a month and a half ago. Yeah, still navigating that and settling in. But I think in terms of identity, it's been a little harder because in med school, it's more taken for granted that I can bring my trans identity into spaces and have that influence how I want to practice medicine. My research isn't really tied to my identity at all. So I think difficult to navigate how out I should be in spaces and how vocal I should be about that when that's not necessarily the focus of my research. I guess hoping that people don't view that as a distraction from my scientific work.
That's a good point. You're allowed to do things and research, and that is definitely a challenge. Just because you share that identity doesn't mean that you have to do that specialty. You can,
Mhm.
but you don't have to. You talked about being in a community of other trans individuals. How has that aspect of community helped you?
I think just the knowledge that other people are going through similar things to you, like even if I'm not best friends with every single other trans student at my school, we have a group chat where we can commiserate. I think admiring the work that students ahead of me have done to advocate for structural change in our institution, even if it's things that I don't know about. I know that things are probably a lot better than they were 5, 10 years ago. And I think just having that sense of solidarity and that I'm not the only one experiencing things like that.
I get that. Not feeling alone. I think that is so important. I think is one of the motivators of starting this podcast, whether it's any type of marginalized identity, when you don't see or feel like other individuals or people hide their struggles, it can feel very lonely. So knowing that you're not alone is so important.
Yeah, definitely. And being able to watch those people progress through training and become residents and then attendings, because I think one difficult thing about being trans is that a lot of the trans people I know are around my age. So it's hard to find role models who are 10, 20 years older than me, who are modeling what it's like to be out as trans as a physician or a scientist.
That is such a good point. I'm glad you told me that. I have a friend in med school. He was the same year as me, and then I took a leave of absence. So he's now about to start his second year as an ER resident, and he's trans. So that reminds me, I'll have to text him and be like, hey, do you want to come on the podcast? Because something I never even thought of, seeing people at different levels and that sense of hope or sense that you can do it. It's possible.
Definitely.
And then the attending thing too, I didn't think about that, but yeah, I don't know any, at least, open individuals in my institution. So if you have any attendings, if you ever talk to them and might be interested, I'd love to hear their perspective, because I didn't even think about how meaningful that can be to see people at different stages in their education.
Yeah, definitely. I know a couple, not any at my institution,
Mhm.
but for the amount of trans students there are now, that number's increased over time. So eventually we'll age up and become attendings.
Do you have any advice for students coming into medical school or in medical school from your years or from talking to others that you can share?
I was lucky enough to be accepted somewhere that had students from my community. I've already talked about how big of a difference that's made. But I think just even if people aren't at your same school, trying to connect with students from other schools, I know that's something I've put a lot of effort into recently. Just share experiences across institutions and also be there for students who are alone at their institution. And I think also trying to find like faculty champions who will stand behind you when you're trying to make institutional change. I know if I have an issue, I had a ton of issues at orientation with not having my correct name on things. And I was able to just email a faculty member and she got everything fixed right away. Which if I was doing that on my own, it would have taken a lot longer, or they just would have probably blown me off because I was a student. Having someone to have your back makes a huge difference when you have issues and when good things happen too.
That is something I never thought about. Are there any other preparatory things? We're about to start a new class of medical students here soon. Is there something that they can prepare for? That way they don't experience as many challenges.
I think different people will face different challenges. Since I was accepted into the MD PhD program, I had administrative contacts who were worried about a much smaller group of students than the MD admissions office that looks over hundreds of students. I was very open about my identity in the application process and the fact that my name was different than what was on the application. That was definitely something that was scary. I don't know how that may or may not have affected how I did at other schools in the admissions process. But I think just being proactive about I'm coming here and this is what I need and treating it as non-negotiable. No, I didn't face any specific backlash, but I think if I had, it would have been a lot more difficult to fight that on my own, especially when you're just an incoming student who doesn't really have much power.
Yeah, that's a good point. I'm so proud of you for doing that because that's really hard to be able to say, these are my needs and this is my non negotiables. And that's amazing. So I congratulate you for doing that. You actually disclosed in your application. Can you walk me through some of the thoughts you had as I'm trying to advise other students of whether or not to disclose their disability? Can you share what the process was for you or what types of things you thought about?
I never really strongly considered not disclosing it because
Mhm.
I didn't want to be called the incorrect name throughout the entire process. There was no other way I could have disclosed that to schools. I also didn't want to end up somewhere that wouldn't have been supportive. I don't know if it negatively affected me at other schools, but if it did, I don't really want to go to school there. The few schools that I did get into were very chill about it and even actively supportive through the process. If I didn't disclose my identity, I could have ended up somewhere that ended up being not a safe space for me.
I'm glad you said that because that is such a good point of if they didn't want to have you, probably wasn't the right place for you anyway. I think that is the same thing. Medical school, nursing school, residency. If they're not going to support you, it's not the place for you in
I
general.
think it's already just so hard that having like additional structural barriers on top of that that other students aren't facing will make it that much harder.
Is there any possible barriers that other students or other health professionals can support their trans classmates?
I think I and a lot of the other trans students at my school feel like pressure, expectation that we're going to be like huge advocates for the community, which I'm happy to do. I've put like a lot of time and effort into that. But I also know people who don't want to do that for a variety of reasons because they're already doing so much work just getting through school in the first place. I think something that other students and faculty members can do is take on some of that advocacy and be allies to people in other communities so that all of that weight isn't on those students.
That's really helpful. You made such a good point. You don't need to be an advocate just because you have a certain identity, just because you have a certain disability or just difference doesn't mean that you are obligated to do something about it. You can, but you can also just be a student. You can also just be a doctor. You can just keep doing. That's just an extra thing. And I like what you said of the importance of being an ally. I think that is something that I identify with trying to be an ally for other marginalized identities, even if I don't myself identify with them. I'm glad to hear that it is actually helpful because I've never thought to ask if it's helpful to be if it's seen positively for like people to be allies. I feel bad about that right now of how it can be perceived from the inside.
Yeah, I would say there's a spectrum on allyship, one just being passive and saying, I support you, but not
Mm.
doing anything about it. And on the other side, being very active and almost putting yourself on the line for other people, which again isn't the expectation, but some people are able to take that on. I think when you're taking a more active role, it's really important to listen to people from the community that you're advocating for so that you're not just as an outsider taking on what you think is right for that group of people.
No, that's really helpful. Thank you. I think that's important for a lot of things, not just placing ourselves as I started to think of medicine almost like saviors of we're going to come in to help you. I was thinking when our preclinical year, we had a leadership project where we would go into the west side of Chicago community, and that was very important. We had to sit down with community members, ask them what you need, what can we do? Because if we come in and say, this is what you need, this is what we'll do, that's not advocating, that's not supportive.
Yeah, those changes usually aren't sustainable. And I also think erodes trust in
Mm,
communities.
that's such a good point, right? Carson, thank you so much for sharing your experience, for being open about your diversity, about your humanism, because that's what I'm trying to show is there is other sides of just being a doctor, being like a profession. Like people are human, people can have different identities. So thank you for sharing your identity and how that has impacted your journey in medicine and in research and science. As we finish up, is there any other pearls of wisdom that you want to provide to other medical students or even other healthcare providers, or anything you want to finish with?
I'll just say thank you for having me on. I think the work you're doing through the podcast is super important. And I'm glad you've expanded all diverse identities. So I think we all have something to learn from each other. And I'm always happy to share. So thank you for having me on.
Thank you. I appreciate that. It's so important. I always like to end with summarizing what you said. You started by chatting with us about your journey into actually, you started with research. You were really interested in expanding that way. Towards the end, you started adding the possibility of being a physician and your own personal identity of being a trans individual, being a part of the healthcare system and seeing how important it is because there's so many health barriers that people face. And you knew that by being a doctor yourself, you could work as an advocate and a person of change. You also talked about how meaningful it is when you've been in preclinicals and in the family medicine clinic, working with patients as a medical student and being able to almost speak the same language of having that trust, that empathy, and almost like it's a cultural sensitivity of being able to feel safe. You also talked about the the importance of having a community of even if there's individuals not in your same school that share the same identity, just being able to reach out to other schools can be so helpful, especially during a period of academics. There's so much imposter syndrome of not being the 1% anymore, not being the smartest person anymore, because everyone is super smart. And you also talked about how to be an ally for the LGBTQ plus community. It's important to listen and ask how they can be an ally and advocate. One of the things that you mentioned that was very meaningful is how when you applied to medical school, you were open to sharing your identity and saying, these are my needs and these are my non-negotiables, and being able to find a school that was accepting of you and being able to support you on your medical school journey, which was so important. Thank you so much for being here and sharing. I always like to ask if there's any way people can get in contact with you if they want to learn more or talk to you.
Yeah, I'm open to people emailing me, but I don't know how you usually share that info.
If you're comfortable with it, or put it below. I can say email me. Do you want me to fill?
Yeah.
Of
Yeah.
course.
That'd be
I'd
great.
be happy to. Yeah, so I'll make sure. I think Twitter X is how we met. I can't even remember how. I think it was just one of the posts you did or something. I'm like, oh my goodness, I need to learn more. This seems like an awesome human being. I want to interview you. So thank you so much for responding to a weird DM from a stranger. I very much appreciate it. You can email me at medpsychmoss@gmail.com. Also on social media, I'm at medpsychmoss. You can also see on my website, I have a couple blog posts that were both during my gender affirming classes, a lot of different educational points to learn more how to talk to their patients about all these really important aspects, different resources. And then I also wrote a blog post in one of the surgeries. I thought it was just a very emotional and meaningful experience. So if you want to read those, you can check them out on my blog. I also have an entire section on resources. It's not as robust as I wanted to, but it will become stronger. But it does link to a lot of different books that I received during that elective and also during speaking with other friends in that community. So you can check that out. Thank you, everyone. You all are not alone in your experience in medicine, in life, whenever you're going through challenges. It's very easy to feel alone in your experience. I hope that through this podcast, through these episodes, you realize that you're not alone, that there are other individuals out there that have also struggled and overcome and have been able to keep going and be successful. I hope that can provide you some comfort and some motivation to keep going. Thank you, Carson, again, and I hope to see you all next week. Take care.